In this video, we will discuss how you can provide structure to your consultations and why this is of benefit to the practitioner and the patient. Welcome to Consultations for Health, helping you progress in your communication skills to optimise the care of your patients. We have discussed on this channel already the benefits of a collaborative partnership between practitioner and the patient. This is only possible if the practitioner structures a consultation in a way that allows the patient to contribute equally, and this video will help to bring these elements together in order to provide structure. Paying attention to the structure of a consultation allows the practitioner to assess the balance of influence over the consultation and means that the practitioner can readdress the balance if they are influencing the consultation more than the patient is. One of the most widely advocated consultation models is that of the Calgary-Cambridge Guide. Providing structure should occur throughout the whole consultation and not just sequentially. A structure running throughout is key to the different components of the consultation being effective. The categories of the Calgary-Cambridge consultation are initiating the session, gathering information, potentially including a physical examination, then explanation and planning before finally closing the session. In order to structure the consultation, there are several smaller objectives that you should bear in mind. Two-way communication is important in every part of the consultation, and it's especially important that you make expectations and agendas overt at the very beginning of the consultation. This encourages the patient's collaboration from the offset and shapes the consultation. We've discussed this in our video on negotiating a shared agenda, which goes into more detail about how you may do this. We're now going to discuss 4 key skills that can help provide structure to your consultations. These skills are summarising, signposting, sequencing and timing. So firstly, summarising. Summarising is when you provide an explicit verbal summary to the patient, and these can take 2 forms. A summary within the consultation on a particular part of it, or a summary at the end which pulls together the discussion. Summarising allows you to pull together and review what you have discussed so far, and realise the information that you haven't obtained yet or need to clarify. It also allows you to order the information coherently and then consider where the consultation should go next while considering the illness and the patient's perspective. The very act of summarising and the patient's response to this will often establish the most appropriate path forward. Next is signposting, which can be considered as the twin skill to summarising. A signposting statement introduces and draws attention to what the practitioner is about to say. Signposting statements can be useful to introduce our first summary, as they invite the patient to think with us about if the summary is in line with what they wanted to get across. You may say something like, "Just to make sure I've understood properly," and the patient can then confirm your understanding, correct it, or add additional details. You can also use signposting to make the progression from one section of the consultation to another, and to explain why you're making this progression. For example, you could say, "You mentioned that the pain is worse at specific times. I'd like to explore that a little more." You would then go on to ask questions about that. Summarising and signposting together help to provide a structure that is apparent to the patient, and then they can be actively involved within the consultation. Next is sequencing and timing, which help to attend to the flow of the consultation. Sequencing, in other words, maintaining a logical sequence throughout the consultation, is the practitioner's responsibility. This sequence should be apparent to the patient as the consultation unfolds, and although being ordered and organised, should also be flexible. One way of achieving this kind of logical sequence is to have in mind a structure that works for them, such as the Calgary Guide, and then adapt this as required. Bearing in mind a structure can help you to bring the consultation back if it goes off track. Lastly, timing. Time constraints are always an issue, so it's important to utilise the time that you have as best as you can. When working through a structure, you should consider the amount of time being spent on each section of the consultation, and if that is appropriate, as you don't want to run out of time for the other sections. This is something that is very hard to teach and comes with practice, and being mindful of managing the time effectively. As well as this, we know that a patient-centred approach and collaboration can actually make the consultation more efficient. In summary, we've discussed how the Cambridge-Calgary model is a good place to start in terms of finding yourself a structure for your consultations, and you should make sure that rapport building and structure flow throughout. We've also discussed 4 key skills to help provide structure that are summarising, signposting, sequencing and timing, and this will help you to build a collaborative and therapeutic relationship. Thank you for watching Consultations for Health. Don't forget to like our Facebook page, follow us on Twitter and subscribe to this channel.